Dear Chair and dear audience, welcome everyone on the 12-month progress report, where I would like to present my PhD thesis, Innovative Multimodal Imaging Techniques in Dermatology. My name is Noémi Varga. I'm a PhD student at the Department of Dermatology, Venerology and Dermato-Oncology, Semmelweis University. My supervisors are Nóra and Marta Medvec, and our vision is to improve the survival of skin tumor patients. And in order to achieve our vision, our mission is to promote the implementation of novel imaging techniques in clinical practice. We have two ongoing projects. Both of them are systematic review and meta-analysis. Our first project is comparing the efficacy of imaging modalities for the diagnosis of malignant melanoma. Malignant melanoma is a melanocytic tumor that is responsible for the most skin cancer-related death, with an estimated death rate of nearly 8,000 people every year. The main reason for low survival rate is delayed therapy, and that's why early diagnosis is crucial. So there is an unmet need to find new diagnostic techniques. Dermoscopy is the currently used non-invasive technique for melanoma diagnosis. However, it has several drawbacks, such as it is examiner-dependent and it has limited diagnostic reliability. Novel non-invasive optical diagnostic techniques use the light and the special properties of photons to obtain more detailed and higher resolution images of the skin. Our aim is to compare the diagnostic accuracy of non-invasive optical diagnostic techniques for the detection of malignant melanoma. So our clinical question is the same: which is the most accurate non-invasive optical diagnostic tool for the detection of malignant melanoma? Here we use the paired framework, where the population is patients with suspected melanoma. Index tests are non-invasive optical diagnostic techniques, reference standard is histology, and the diagnosis of interest is malignant melanoma. We plan to compare all the non-invasive optical diagnostic techniques to the reference standard histology and compare them with each other as well. Our hypothesis is that novel non-invasive optical diagnostic techniques have better diagnostic accuracy than conventional dermoscopy. Here you can see our systematic search and the flowchart of selection. We started with more than 16,000 articles, and at the end we had 141 eligible full texts. This slide presents the results of random effects diagnostic meta-analysis comparing the sensitivity and the specificity of these various imaging techniques used in melanoma diagnostics. On the left, you can see a bivariate plot comparing the sensitivity versus specificity of these investigated imaging techniques with different colors indicating different techniques. This figure helps us to visualize the diagnostic performance of each method, and we can see the overlap between the techniques. The table on the right is the detailed summary of the sensitivity and specificity results of these techniques. The statistical analysis revealed that dermoscopy combined with artificial intelligence and reflectance confocal microscopy reached the highest sensitivity. However, their specificity slightly varied. On the other hand, multispectral imaging combined with artificial intelligence also reached high sensitivity and specificity results. Standalone diagnostic tools like dermoscopy and teledermoscopy showed a strong and balanced performance, and pure multispectral imaging reached a low specificity result. On the other hand, in addition to these three optical imaging techniques, we also investigated three other techniques, but due to the limited number of the articles, they are presented on forest plots. These forest plots depict the sensitivity and specificity of these three other optical imaging techniques. Based on our statistical analysis, dermatofluoroscopy reached the highest sensitivity results. However, its specificity became the lowest. Optical coherence tomography reached a moderate sensitivity and specificity result, but it was very balanced performance. And reflectance confocal microscopy reached higher specificity than sensitivity, but both were lower than the others. And to conclude, we ranked all the imaging modalities based on the UDEN index. The UDEN index provides a summary measure of the diagnostic accuracy of these diagnostic techniques. And this table also summarizes the corresponding level of evidence for each technique. And the techniques are ranked based on the UDEN index. Here we can say that integrating artificial intelligence with diagnostic tools like multispectral imaging and dermoscopy can significantly enhance the diagnostic accuracy of an imaging modality, particularly in terms of sensitivity. Standalone diagnostic tools like dermoscopy, optical coherence tomography, teledermoscopy, and reflectance confocal microscopy, they showed a strong performance, and they offer a balance of a high sensitivity and specificity, making them a very reliable tool for melanoma diagnostics. Also, reflectance confocal microscopy reached a high level of evidence, which can underscore its reliability. Raman spectroscopy, multispectral imaging, and dermatofluoroscopy had the lowest Huden index, and this can mean that these techniques may be less effective compared to the top performers. We have strengths and limitations. The large sample size is one of our strengths, encompassing a large number of patients and lesions. Lesion numbers facilitating a comprehensive analysis of these non-invasive optical imaging techniques for the diagnosis of melanoma. The heterogeneity in the type of the studies and differences in testing strategies limited the systematic comparisons of these optical diagnostic techniques. All in all, we can conclude that dermoscopy still remains the most effective diagnostic tool for skin melanoma, and it has several implications for practice and research. A more objective and accurate detection of melanoma can be reached with the use of artificial intelligence, and it's beneficial to implement a multimodal imaging technique to clinical practice that can improve the survival rates of melanoma patients. Here you can see we wrote the manuscript of our first project, and it's with the supervisor, and we plan to submit our manuscript to the Journal of European Academy of Dermatology and Venerology. Our second project is comparing the diagnostic accuracy of imaging techniques for assessing Breslow thickness in malignant melanoma. As I mentioned previously, melanoma is one of the most dangerous skin tumors, and early diagnosis and treatment can lead to a better survival for melanoma patients, and that's why early staging is crucial for these patients. The stage of the melanoma is primarily established based on the Breslow thickness. However, it is unavailable at the initial clinical diagnosis of melanoma. Accurate preoperative prediction of Breslow thickness can determine the exact surgical safety margin for melanoma patient, the stage of the melanoma, the need for sentinel lymph node biopsy at the same time as primer surgery, and it sets out further imaging procedures such as PET-CT and MRI to increase the survival rate of these patients. Therefore, our aim is to compare the diagnostic accuracy of non-invasive diagnostic techniques for the preoperative prediction of Breslow thickness in malignant melanoma. Our clinical question is, which is the most accurate tool for this purpose? Here we use the same paired framework as previously, but the diagnosis of interest was the overall diagnosis of Breslow thickness. Our hypothesis is that the diagnostic accuracy of non-invasive diagnostic techniques is non-inferior to the histological evaluation in the preoperative prediction of Breslow thickness. Our second project seems to be feasible, and this is our summary of our projects. We plan to submit both of them this year. And I would like to say goodbye and thank you for your attention with the quote of J.K. Rowling: "It is important to remember that we all have magic inside of us."
I think in the first project you said that you want to improve survival. Maybe I missed it, but like, how do you think that you can improve survival based on your first study?
It can improve the survival of melanoma patients with faster diagnostics, and it can speed up the therapy for these patients. So
compared to?
Actually, while our research included the dermoscopy, so I would say that if we can implement multimodal imaging, which can include dermoscopy, this can hasten the diagnostics and speed up the therapy for the patient. So I would correct myself.
And in the second project, you mentioned a few things about Breslow depth. So how do you see this in the practice? So let's assume that you run this in 1,000 patients, and then you identify that your model predicts with some sort of sensitivity and specificity how deep the Breslow is, then what would you do differently than what you do now in the clinical practice? If you can identify some patients with Breslow depth of 3 millimeters by your method.
Can you repeat the
What
end?
would you do differently in the end if you find a patient
Okay.
with 3 millimeters of Breslow depth or 4 based on your method?
Yeah, okay. As far as I know, in clinical practice, they mainly at first operate the melanoma, and after that, when they measured histologically the Breslow thickness, they perform the sentinel lymph node biopsy. And if we would know previously or at first the depth of melanoma, we can perform it at once, yeah, in one stage. Okay, I would say that I would do it differently. And if we would know the depth of the melanoma and the Breslow thickness, we could perform and request for an MRI or PET-CT sooner as right now. And I would change these in clinical practice.
I would like to ask also one question regarding the first topic. That I would like to ask that if you can choose only one modality based on your results, which would be the one that you would like to improve and upgrade in the near future?
Yes. If personally, thank you for your question. If personally I could choose one, I would choose reflectance confocal microscopy. So it's very, yeah. So it can provide for the clinician a very detailed picture of a skin tumor, and I think it's a very useful diagnostic tool, but it is very expensive. So I would change the price at first, but I think it is very reliable. Based on all of the articles I've read and based on the grade, score, and the level of evidence, it was the most reliable tool, all of the others. So it was more reliable than dermoscopy. So if it would be a handheld device and a cheap device, it would be the perfect option, I think.
And can you measure or estimate regression with any of those models in a melanoma?
Regression? What do you mean?
Like previously there was a melanoma and then immune system came there, the tumor cells disappeared, and then sometimes we can assess this in pathology by regression. Any chance you can see that with any of the methods?
I think with reflectance confocal microscopy, if we follow the patient, it can be measured. Or I don't know if the question was about this.
Is any of these methods, imaging methods, available in clinical practice anywhere in the world besides dermoscopy and used in actual clinical practice?
As far as I know, they shortly use them in clinical practice in Hungary as well. Like in Szeged and Pécs, they use reflectance confocal microscopy, and in Debrecen, they start with the OCT in dermatology. Yeah, and here teledermatology also was in practice while it was COVID-19, so mainly these imaging techniques.